Are you a marketer at a digital health vendor or agency that's trying to get the attention of health systems? Well, you need to hear this. I sat down with Pam Landis, Senior Vice President of Digital Engagement at Hackensack Meridian Health Network, and she was refreshingly candid about how decisions really get made inside a provider organization. In this conversation, Pam busts some of the biggest myths vendors and agencies cling to, like the idea of a single decision maker or that cold outreach is your best shot to get their attention. She shares what actually earns attention, what gets ignored, and what's the fastest way vendors can blow their chance. If you want to stop wasting time on the wrong tactics and learn what health system leaders actually listen to, then this interview is for you. Let's get to it.
Swaay.Health.
Pam, welcome back to the program.
Oh, thank you for having me. It's always good to chat with you, Colin.
It's always good to have you. I wish we were in person, but this will have to do until we see each other at the next conference.
Exactly. Absolutely.
Well, I'm excited, Pam, because today we're going to dive into a topic that I get asked a lot about. And I thought it's time I should ask people who are actually in the business, living it, breathing it. And that is demystifying the healthcare buying process, at least when it comes to marketing and strategy and so forth. But yeah, I'm excited to dive into this with you.
Great. I'm glad to talk about it and share my experience.
Okay. All right. So Pam, let me start by asking this hypothetical question. If we go right to the genesis of a project or a genesis of an idea. So say I'm a person on your team at Hackensack Meridian. Can you walk me through what I, as an internal advocate, would have to do to get attention and eventually budget for that project I want to champion?
Yeah. There's a couple things. So this is how I approach it. First of all, what we look at in my division is how am I supporting Hackensack Meridian Health's network goals? And if it's not on the network goals, I'm not doing the work. If I'm not there to serve what the goals and the strategy are of the health network, then I've got to really rethink the work that I'm doing. And that's the first thing I look at. I look at the goals for the network and say, what can I do and what can the team do to make that successful? And so that's how we plan our year. What are our network goals? And how do we plan our work around that? That's the first thing I do. And then after that, we start to look out into the market ourselves and actually look at our own internal tools and say, what makes sense? What do we have in-house that we should be optimizing? I always look there first. We have core systems at HMH, like every health system in the country. And I am not there to rip and replace core systems. I am there to get as much value out of those systems. And when they don't meet a specific need, then we'll go out and look into the market.
Okay. So naturally, because you've already made investments in these systems that you have internally, that's where you would look first to see.
Yes.
And I gotta ask this: do you often find that maybe there is functionality at those systems that you're maybe not using or didn't know about before, and that's the sort of search ends there?
I would say about 50% of the time, not much more. But what I will say is, and sometimes in that 50%, they'll get you 80% of the functionality that you want.
Okay.
And you have to decide if, 50% gives us this. And you have to decide, is the squeeze worth the juice or the juice worth the squeeze, whatever the metaphor is, for settling for the 80%. It might be that that's perfectly okay. And those are the first cuts that we make in determining whether or not to onboard another technology.
And Pam, is it typical that I, as the champion, would I have had to get buy-in from other groups, or is it a solo champ? Like, do I have to get
Oh,
clinical buy-in? Do I have to get IT buy-in? Like, how much buy-in before I start bringing things forward?
you have to absolutely get buy-in.
Okay.
And more, um, because of the work that we're doing around patient engagement, digital patient engagement, you better have buy-in and partnerships, not even buy-in. I would go even one step further. I would actually say that you actually have to be aligned with the operators. So, for instance, in digital engagement, when we're looking at tools for our patient access center, our medical group leadership is lockstep with us in understanding what the need is, when understanding what the tools are, and supporting that. When we were looking to upgrade a Find a Doctor system, you better believe that doctors were part of that selection, that IT was part of that selection, that practice managers were part of that selection, credentialing was there, compliance people were there. They have to be part of that. That's the best way to do it. And most places will work that way. Um, that I can't imagine onboarding technology without having the business operators right there to support that selection.
And does that buy-in or that endorsement partnership, as you called it, does that
Hmm.
happen before you even start even looking? Like, is it more?
Yeah,
Oh,
yeah,
okay.
absolutely. Like I'll say to our physician leadership, we believe to hit this goal, to do this, we need to go out into the market and look at these things. And if they say no, it's not a priority for us, I'm out. I'm not going to force something onto an organization that might not be ready because they might have other priorities. Like, as much as I think the work that we do in digital patient engagement is the bee's knees and the most important work that can be done, you know, there are other goals, there are other strategies that might take precedence over that. And you have to be okay with the priorities that the leadership sets.
So it sounds like you have to do a lot of work internally then before you even go outside to look for solutions.
Yeah, I would never go out to look for a solution without that internal buy-in done. It just doesn't make sense. Now there might be some small system or something like, some back end thing you need, but for the most part, in the last 4, 5 years, I've had for all the big purchases, it's all been um, with our partners.
And in terms of that buying committee, yeah, your different clinical groups, your
Mhm.
operators, and so forth. Um, I know well, the answer is probably it varies per project, but does any one group have more influence than another in terms of making these decisions? Like, is it your call to make at the very end of it because you're the one having to live with it? Is it the operators that have the most influence, over these kinds of decisions?
I am not comfortable being a just one person decision, because once you get to implementation and once you start getting into the nitty gritty, if they feel like this is something that's been forced on them, versus, I have to tell you, it just makes the project harder. Um, I think it's my job to build consensus amongst the partners and the stakeholders internally. That's my job. And it might be that they like something better than what I do. And if I feel strongly about it, I might say and have a conversation with them. This is why. And and just have a really good conversation and to be open-minded both ways.
Gotcha. Gotcha. Okay, so it sounds like you do all this work, getting buy-in and partnership, making sure there's a heavy alignment between this project and the goals of the organization,
Yeah.
because that's like a non-starter if it's not aligned. Um, so, and then at that point, when you have all of this buy-in, it sounds like it's that point that you look internally first to see if you already have something, and then only
Right.
then you look externally.
That's right. Absolutely.
Okay.
Yeah. It doesn't make sense. Listen, our job is not to continue to overburden IT resources. They
Right.
are scarce in organizations. They are valuable. They are busy. And quite frankly, if we have something in house that can do the work, let's do that. But the other thing is to realize that they also have a seat at the table to understand how anything would fit in the overall ecosystem of the organization.
Right. Right.
Yeah.
Because ultimately it's going to be on a server or something they're going to have to do to support this thing.
It could be like, for instance, there's some kind of piece of software that only works on Windows devices. Well, or only works in Microsoft Edge. Well, we're a full Google shop. There are Chromebooks, you know, 40,000 Chromebooks out there. If it's not going to work in Chrome and on a Chrome device, it's a non-starter.
It's not started for you. Okay. So when you're at the point of looking externally after you've done all of this work beforehand,
Mhm.
where do you go to look for new solutions? Where do you
Yeah,
turn to discover those? Do you walk exhibit halls? Do you phone a
I
friend?
do.
How do you do that?
Yeah. So I will admit to being, I'm a thief.
Okay.
And so I look out what um, other high performing organizations are doing. How are they doing it? And I talk to my colleagues at those organizations, but we also look out at how the general consumer industry is doing this work. I do a lot of research on my own. There are a lot of blogs that I read and a lot of podcasts that I listen to really understand what's out there in the marketplace, what's possible. And I do walk the exhibit halls. Now, here's how I walk the exhibit halls. So I know that I need something, but you know how in exhibit halls, they all want to scan your badge and then they have your email and they start calling you like 1,000 times afterwards. I like turn my badge so they can't see my QR code. And I stand in the middle of the aisle because I will stand back and watch. I will watch them talk to other folks. I will watch their demos. And then if it piques my interest, then I'll go up and I'll say, I'd like to have a conversation about this. And it could be, that's not going to meet our needs. Or it could be, this is interesting and it's worth further discussion. Now call me. Let's set up a meeting when we all get back home. Yeah. But I'm like, I guard it and I pick and choose. And I don't go shopping for things that we need at HMH, like I go shopping for shoes. Like whether or not like I might go shopping for new, high heeled pumps for work. But if there are cute tennis shoes there, I might pick those up too. When I'm in looking for HMH, I am very laser focused on fulfilling one specific need. I will watch the other vendors to be educated on what's out there. It might come up like, oh, I remember seeing this somewhere a year later or 2 years later.
Right. But you're not walking the exhibit hall kind of like you are when you walk a mall, just kind of saying, oh, that's nice or that's interesting. You're laser focused on seeing certain vendors. And even then you're guarded in the sense of you'll
I
watch and
am.
see what they do first before you decide to engage.
Yeah. Yeah. In a mall, you try, when you were a teenager, you went in every store.
Right.
I don't go in every store.
Gotcha. And how do you and you mentioned it at the top. So deciding who you're going to stop at and who you're going to see, part of that is related to who else they have solved problems for. And if those are one of your trusted peers, you might give them a little bit more weight.
Exactly right. Exactly right. And, and if they've solved problems for those folks, and then that's exactly where it makes a difference. And I want to know where they've solved them at scale.
Mm, okay.
How many times have I sat through presentations where they put up the logo slide, the company? We are deployed at all these places. And if you get to somebody like me and I'm like, well, I know 10 of those places, and I know my counterparts at 10 of those places. And I know that you're doing a pilot. If you I'm not in for the pilots.
Gotcha.
So don't tell me, oh, we've deployed at the greatest health system in the world, but it's only in one subspecialty with one doctor running a pilot. That
Gotcha.
I'll
So,
suss that out really fast.
right. So it's not logo scale. It is
No,
actual scale.
exactly. Like, are they using this across their enterprise?
Okay.
Yeah.
Do you use, and you won't offend me, but do you use any other sources to inform you on possible solutions? Do you use like people who do industry reports,
I do.
those kinds of like a Gartner or a class or something like that? Do you look at
Mhm.
publications? Um,
I do. I look at Gartner, I look at Class, I read your stuff, I read hospitality, I read his talk, HIS talk. I read all of that stuff. I follow Chrissy Farr.
as far, yep.
I follow. I like. I'm really interested in who the people who have been around the industry a long time, what they think of some of the companies. That's actually really important to me.
Okay, good to know. And okay, so you've gone out, you maybe do the exhibit hall thing, you find a couple that and engage with a couple that you think are interesting. What happens at
Mhm.
that point? Do you sort of take a look at it first and act as the gatekeeper for your organization?
I
Do you
do.
immediately bring other people in?
No. So if I have a project, so yeah, if I'm interested in them and I think they're curious, they piqued my curiosity and that they might be able to fulfill a need, I'll have them come in and talk to me and some key people on my own team first. Because sometimes, the booth is like amazing and the presentation is like rock solid. And then you bring some of our folk, and then you're like, oh, but this doesn't interoperate with Epic. Or you'll say, are you in Epic's showroom? And they don't know what the showroom is. And I'm like, yeah, we're out. I can't do that. So I think I do make sure that we first I first look at them first because I don't want to waste my partner's time. I don't want to waste the doc's time. And if it's a big project, we'll go to an RFP. We will definitely go to RFP.
Gotcha. Gotcha. And is there ever a case, Pam, where someone will bring a solution to you that maybe was on some of the operating teams that you're working with? And do you
Yeah, they've often said, "Hey, I saw XYZ. This somebody, made a pitch." And I'll like, "Okay, let's take a look to see. But where does it fit in our plan for this year? Where does it fit in my budget for this year?"
right?
Mhm. Yeah.
Okay, well, you went there, and that's my next question, actually. So let's talk about budget for a minute, because
Yeah.
this seems to be a great mystery for a lot of people. But is it true that first of all, is it true that you have an annual budget, and then once that budget's set, you really have very little leeway in terms of like getting double that or getting lots of more budget sort of throughout the year? It's pretty well set at the beginning of the year of your fiscal year, is it not?
Mhm. It is. And so, yes, we have an annual budget. Ours is a calendar year. Other places have the end of June, year, September. Ours is calendar year. But yeah, those budgets are set, and I'm held accountable to that. And it might be that's part of the planning. Like right now, I'm doing my planning for 2026,
Right.
and I know and I'm budgeting appropriately. But here's what I'll also say. If you're bringing in large systems and doing big spend, especially around technology, I need to understand the difference between capital and OpEx.
Mm,
And so those are two different budgets. And, and if there's an immediate need, yes, you can go and get a variance for something like we immediately need this XYZ, there's a value to this. Yeah, you can do that. But by and large, 90% of the time, I'm sticking to what the plan is. Um, and I need to understand what the capital requests will be.
right.
My boss needs to know what I'm going
Of
to ask
course.
for capital.
So if you're, but we'll just use it as an example. And by the way, anyone watching or listening to this, please don't use this as the playbook of how to get to
No,
Hackensack Meridian.
please. Yeah,
But
I will hit delete.
Yes, but
We should do a section. You should ask me a section on what not to do.
I will at the end. That's my final question. But Pam, so if your calendar year and you're working now, and it's, you know, now being August when we're recording this, now is when you're doing the planning. What does that mean in terms of how far back did someone would have to have engaged with you? Like, because by now, if you're budgeting for something, you know, what solution you're going with, you know, the technology, its impact, and how much it's going to cost you. So I'm going to assume like this is sort of talking beginning of the year that you've done all this
Yeah.
work, right?
Yeah, I would say that, and I feel for those folks who are in companies selling into health systems, the sales cycle is really long. I know. I get it. I 100% get it. I'll give you an example. We're replacing a big system in 2 weeks. The discussions with the companies that we invited to the RFP started last spring, not spring 2025, spring 2024.
Right.
The RFP went out in the summertime. We made the eliminations, the cuts, the 4 that were invited for the demos were in September. The selection was made at the 1st of October. Contract negotiations began. Contract wasn't signed till February.
Right.
So, and now we're in implementation. So I would say that, there's a long sales cycle to these things. And, and I am one of the sensitivities we will have is price sensitivity. And I want everybody out there that's listening to understand health systems are under increasing pressure. And our 2026, 2027, and 2028 budgets, with the changes in the federal legislation and the federal budgeting and healthcare coverage, is going to have a dramatic impact on budgets. And we are going to protect our people and our patients first and do better. And I will tell those folks selling into organizations like us, you're going to have to get really price competitive. I know they think it's worth XYZ. Dude, you're a commodity. No, it's not.
Well, and back to what you said before, if you're price insensitive as a vendor, you may push an organization like you to accept the 80% good enough solution that's already incumbent, right? Because
absolutely right.
That cost
right.
That delta may not be worth it.
Absolutely right. Yeah, absolutely right.
So,
and the other thing that I do that's I think is important, not only do I have partnerships with folks, when we're doing a big project, my boss and I feel it's really important to socialize it to people who it might not impact directly, but so that they're aligned with the strategy, because they're all working on supporting our network strategies. So I make sure, like on a big project, I've got a big project that's kicking off next month. I went to every single senior vice president in the company and said, this is our idea. This is our plan. What do you think? And basically, a lot of them gave us a lot of really good feedback. We've made changes in our thinking and our plan and what we were looking for. And then I took it to my boss and said, okay, now let's take it to the executives. They said yes. Okay, now let's take it to the board. They said yes. So it was, I think it's really important to do that internal socialization too on big projects. You don't have to do it on everything, but on the big strategic stuff, you better do it. Yeah.
Gotcha. So again, like you're talking about a big wave of internal support and buy-in and partnership, a lot of work beforehand, even before you go out to see a vendor, and then there's the whole budgeting process. And given what's happening now, as is always, but there's always a chance that what you put in can get cut, right? So even though you want to do this project and everything's thinking you're lining up, but you could get cut, right?
Yeah, absolutely. Hackensack Meridian Health has a strong commitment, and we've been really blessed here, and our doctors do great work. I mean, You know, we're the #1 hospital in the state, and we're a 9-year-old company. And in 9 years, we made the U.S. News and World Report honor roll. I mean, we're really proud of the work that we do and the commitments that we have, but we owe it to our patients to be good stewards of the money that they're paying for their health services. I really believe that. Every time we're spending $1 in my budget, that's $1 less for a nurse or a community health worker or a lab technician. So I'm going to be really cognizant of that.
I think I need a hallelujah button or something to press when people say, because you're absolutely right. Like I tell people, but they never think it, that your dollar spent on software is one less dollar spent on an MRI machine, is another dollar less
Absolutely.
spent on your nurse. And that's essentially sometimes what you're competing against, right? In terms of
Exactly.
budget. So
That's
don't
exactly
be
right.
surprised when you do all this work and at the end it doesn't go through and then you have to wait another year.
Yeah, exactly.
Gotcha. Okay, well let's get to the question that you posed. So what mistakes have vendors made with you while attempting to do business with you?
Yeah, calling my personal cell phone. Oh my gosh, what are you doing? I'm like, what are you doing? Like, and in the middle of the workday, like, or I guess it would be worse if it were after work, but they just like call. And I'm like, I pick up, I'm like, hello. Um, and they're like, don't do that. No. Um, the other one is on LinkedIn when like, and I accept most connections, unless there's some like really spammy one that's like, oh, you're a bot. Um, but I'll accept it. But as soon as like you accept it, boom, within seconds you get the sales pitch. And I'm like, you don't even know me. Like, uh, or know what we're about or you haven't even researched me or HMH or the New Jersey healthcare landscape or something. Like, take a minute. So I don't usually respond to sales. In fact, I don't respond to sales pitches on LinkedIn. It's just like, it's a lot of noise. And you have to decide, I got to stay focused on the work too. Yeah. So those are two things not to do. Don't oversell yourself in your logos. Be really honest and true and say, hey, listen, we've deployed this at 3 places at scale, and here's their results. I respect that. Like, I get it, especially in the startup world. I 100% get it. Yeah. Be
So
willing to look at be willing to look at you only at-risk contracts. You're new and you're unproven. Okay, we'll take a chance, but this is going to be at risk.
gotcha. So you're looking for flexibility from your vendors as well.
I am. Yeah.
Okay.
Yeah.
Okay.
I will say, I really think it's important that all of us, and I don't know that we all think about this, we all get dazzled by the gadgets and the gewgaws and the flashy conferences and taking people out to dinner and like, or asking me, well, we would like to, pay for you to go to blah, blah, blah. And I'm like, I can't accept anything like that. You know, I'll go to your conference cocktail party and eat your little, we need, pigs in the blanket. But when you're offering me, oh, if you'd like, you could go down to the spa on me. No, don't do that. No. Yeah. Um, so I think it's really important to keep in mind who you align yourself with, the character of the people. I really want to build partnerships with our vendors. And the character of that person really matters to me, that it's somebody that you can have an open and honest conversation with. So that it's really important to me that when things go sideways, and I can't even think of a project where at some point things didn't go sideways, that we could have I'm going to swear, don't bullshit me. Say it went sideways. This is how we're addressing it. This is how we come together to fix it. I'm okay with that. But when you start to kind of like cover it up, I am not. I don't have time for that because it really just delays it just damages the relationship long term. It really does. I have
Gotcha.
to actually trust that you've got our back and we're in this together.
I
Yeah.
love it. And you shared so much with us. My final question for you on this topic is, what's the one piece of advice that you would want a vendor listening or watching this to take away? What's that one piece of advice that you would give them?
Yeah. I would say actually know our business, know our market, and understand what the challenges are in delivering healthcare in a market like this and how you fit.
I love that. I love that.
Yeah.
Do your homework.
Do your homework. Yeah, exactly.
Well,
Yeah.
Pam, where can people go to learn more about Hackensack Meridian Health?
They could go to hackensackmeridianhealth.org.
Awesome. Pam, thank you so much for being
You're
willing to come on
welcome.
camera and talk about this. Thank you for being so honest and vulnerable. I really appreciate it. I think anyone listening and watching this is going to take a lot
Thanks.
of great takeaways from this one.
All right. Thanks a lot, Colin. Bye-bye.
A big thank you to Pam Landis for being so open about how things really work inside a health system. If you're at a digital health vendor or a marketer at an agency, I hope this gave you a clear sense of what to stop doing and what's actually worth your time. Now, I'd love to hear from you. What's been your biggest surprise trying to market and sell into a health system? Drop it in the comments. I read every one. And if you found this video helpful, don't forget to like and subscribe. And also check out all the other great interviews at Swaay.Health's channel. We've got more candid conversations with marketing leaders coming your way. I'm Colin Hung, and I'll catch you on the next video.